Alright, lesson 4, substance abuse, paragraphs 4 through 10. Identify symptoms of the treatment of overdose withdrawal of the opiates. Give an example. Identify signs and symptoms of the treatment of overdose withdrawal of central nervous system depressants. Identify example of signs, symptoms, treatment of the overdose withdrawal central nervous system stimulants. Identify signs, symptoms, treatment of the cannabinoids. Identify example of signs, system treatment of the overdose withdrawal of the psychedelics. Identify signs, system treatment for overdoses phenacetyline. Lesson 4, Introduction. Substance abuse that involved with alcohol, cocaine has become a major health problem in society today. Substance abuse more commonly called of the drug abuse that has tragic consequences. For example, extremely high rates of the alcoholism and the cause of the cocaine abuse among the star athletes and entertainers. 1950s, drugs and substance abuse also abuse referred mainly to heroin abuse, and people that being doing and abusing live mostly in the rundown areas of large cities. Today, millions of people in the United States are drug abusers. They come in from all parts of the American society, including people from all age groups. Historical view of the use of the drug is not new to historical history with civilization. For centuries, people have used a variety of spirits, herbs, and potions to reveal feelings of sadness, loneliness, tension, and boredom. Opium, for example, had been used for about 5,000 years. From 130 to 201 AD, opium was thought to resist poison, snake bites, curves, headaches, vertigo, deafness, epilepsy, asthma, spitting of the blood, fevers, and leprosy, and variety of other maladies. As long as the drug was moderately, society seemed to have deceptive their use when the drugs have been taken excessively. Society has declared substance drugs use illegal, labeled users of the criminal. Definition of the substance of the drug abuse. Definitions follow the excessive taking of substances such as alcohol for the drug and usually self-administered for the produce effect of the mood, thoughts, feelings, and substance for taken without a device, direction of a doctor, nor treatment of the disease of the health. Problem of the drug effects could lead to the antisocial behavior. The term substance abuse for the drug abuse will be given the meaning of the same thing throughout this lesson. Substance and drug effects. How the substance and the drug affects each of that depends on several elements of man with taken in one time in the past. Drug with extreme with the use of the circumstances in which drug is taken in the place of the feelings of the activity, the the presence of the other people, the use of the alcohol, the other drugs, in the same time, and the manner in which the drug is taken and inhaled, smoked, with injected, and ingested. Short-term effects that refer to the sign of the symptoms appear with a single dose that disappear within a few hours in a day. Example, short-term effects for the highly experienced user after the small doses of marijuana. Long-term effects of the signs and symptoms which appear with the following repeated use of substance drugs over a long period of time. For example, the chronic heavy use of the substance cannabis classification show loss of energy, drive, slow, fusing again, impaired memory, apathy, and may also suffer the bronchitis or other respiratory diseases. Additional terms, psychological dependency. This means the drug has become central to the person's thought with emotion, activities, and even to continue with the using amounts of drugs satisfied with the craving, the compulsion for the dependency with the mental and emotional adaptation with the effect of the drug. The abusers like the way the drug makes them feel, but wants to re-experience with those feeling that actually believe that he cannot function without the drug. With the drug helps the abuser with escape from reality with the problem of frustration. Drug is effects for the team that provide with the answer for everything, including disenchantment and boredom, as long as he takes the drug as well as all seems well. Psychological dependency, which causes the abuser who has withdrawn with the physical dependency to the return of the drug abuse. Physical dependency of the body has adapted thoroughly through the presence of the drug with the user experience with the withdrawal signs and the symptoms here at the top of the drug. Suddenly, with the repeated use of many of the drugs can physically depends. The body learns not only to live with the drug, but also to tolerate, but to require increase the dose of the drug with the withdrawal. The signs of the symptoms verify the amount of the kind of the drug with the abuser has used. Once the person has made the body adjusts being with the drug, withdrawal symptoms often disappear. In some cases, there are permanent effects that cause of the drug, and these effects do not disappear. Tolerance, the term refers to the person who, with some of the drug, regardlessly finds with a constant increase of the dose in order to give it an effect for the equal extreme of the first dose. The body has adapted to the presence of the foreign substance of the drug, with not record the foreign substance for unique feelings. Tolerance is not developed for all drugs and in all people, but those who use the drug, the morphine, find the tolerance builds up very quickly. Note the tolerance does not develop all possible effects of the particular drug. For example, the tolerance develops a euphoric life affects feelings, well-being, of heroin, but only slight with the constriction effects of the pupil over the eye. The complete tolerance of the drug toxic poisonous effects may not be developed with the person, and this may be also with the drug abuser give himself with a fatal dose of the drug. For behavioral changes, all substances which can be abused can cause change of the person's behavior. The particular large amount of the substance with improper use after taking substance with a drug the person may has become withdrawn, solitary, social, talkative. On the other hand, he may be easily moved with 2 years of laughter. He becomes very argumentative to believe that someone is out to get him. Some change with the behavior that harmless to the danger both the user and society. Much of the public concern with the drug abuse comes from the wide publicity given to change the behavior of the company with the use of the drug. For example, LSD has been particularly responsible for the bizarre behavior, addiction, and habituation. The terms of frequent between the confused. Addiction has been defined as a state of the periodic chronic intoxication produced repeatedly consumption of the drug involved with a tolerance and psychological dependence, usually physical dependence with the overwhelming compulsion of the continuing use of the drug. Addiction is detrimental to both the individual and society. Habituation has been defined with a condition of the results repetitively using the drug with no evidence, tolerance with little psychological dependence, no physical dependence, desire, but not a compulsion with a continue to take the drug because of the makes of the person feels good, but the individual's health may get worse if the drug addict is unable to stop without getting professional help, also without experiencing withdrawals and signs and symptoms. On the other hand, the person with a drug habit should be able to stop the use of the drug if it can just be found another way of feeling good. 4.2. Opiate is a narcotic definition. An example of the term opiate is described as a natural synthetic drug with a morphine-like action. Drug with referred to as a narcotic analgesic or narcotic painkiller. The principle of the medical use of the drugs is for the relief of the pain. Opiates can be grouped into three classifications: natural substance, opium, morphine, and codeine. Semi-synthetic drugs produced from the minor chemical alteration, basically poppy products. Heroin is an example of synthetic angiolinism, meridin, proxyethorphan, opium, morphine, heroin, methadone, and meperidamil are all examples of opiates. Opiate and narcotic abuse. The appeal of the morphine-like drugs lies in their ability to reduce the person's sense of the psychological, physical stimuli, with the give the person the sense of the well-being. The drugs dull with the fear of the tension and anxiety under the influence of the morphine-like opiates. The user usually is lethargic, indifferent when you give the environmental personal situation. For example, a pregnant addict would usually continue the drug abuse despite the fact that their baby will be born addict with the probability would die shortly of the birth unless the medical treatment is undertaken any at once. Here, indifference for the personal situation. Pregnancy is greater than a shoe that does not care enough to stop taking drugs with enough of the drug with a hazard to hear health and health of the unborn child. Result of the chronic opiate with the narcotic use with the price tag with abuse of the opiates is high, with the chronic may be relieved with a physical psychological dependence. With the psychological dependency more severe with the two because of the user still be psychological dependent drug even if they stop using the drug with a person who uses the drug chronically develops tolerance finds that he needs ever increasing doses to get with the desired feelings. As when the need of the drug increase, the user's activities become more drug-centered, the drug supplies are cut off, the user suffers with withdrawal symptoms. Signs and symptoms of opiate and narcotic abuse. Opiate is a substance combined with the action of the anxiolytic painkiller. Hypnotic sleep produces euphoria and good feeling produces various signs and symptoms experienced someone has taken the opiate and narcotics related with these three characteristics. Intoxication, overdose, and symptoms include to increase urine output. Opiates stimulate with the antidiuretic hormone, causing the body to put out less urine. Pinpoint non-reactive pupils. Opiates can cover the pupils, the eyes, constrict, get small, constipation, motility, spontaneous movement of the gastroenteritis system with the opioids. Sex hormone level to depress those who with the morphine derivative, lower sex drive with the menstrual cycles, and heroin addicts change wheels with a high with the injection site with the generalized itching, decrease with low blood pressure. All of these result with the blood releasing histamines. Suppressed cough, the relaxed drowsiness, respiratory with the depression, coma, all of these causes of the opiate general the depression of the body, central nervous system, respiratory, or if the possible the coma occurs if the dosage of the drug is high. G subnormal temperature, hypoventilation, diminished ventilations, withdrawal, and signs of symptoms from the nature of the withdrawal and severity of the symptoms depending on the particular the opiate and narcotic involved with the total daily use of how long the opiate has been used, the heavy health and personality structure of the user, generally short of the drug with affects the life of the drug with a more intense is the withdrawal time. Withdrawal symptoms for opiates begin within 3 to 48 hours after the last opiate use. The Demerol withdrawal begins after 3 hours of the last dose. Morphine, heroin withdrawal begins with 8 hours after the last dose. The methadone withdrawal begins 24 hours after the last dose. When the person is dead, opioids or narcotic does not go a dose of the drug with roughly 8 hours, the individual begins to experience with withdrawal symptoms. For some users, the withdrawal is not dangerous or even very painful. Some users withdrawal without outside help. In other cases, however, the withdrawal is both painful and dangerous, and withdrawal signs and symptoms include the following: excessive secretion with tears, profuse water, nasal discharge, sweating, nausea, vomiting, elevated pulse and blood pressure, internal intestinal spasms, diarrhea, goose flesh, hyperventilation, pH imbalances, dehydration. This concern because of the sweating and the vomiting, diarrhea also all contribute to the loss of the blood fluids. Excessive loss of the blood fluids can have body part of the function properly evaluate, eventually be fatal. No individual attacked with the opiate narcotics found with himself with his life more and more centered about getting in with the drug with addiction usually leads to the lying and stimulant association with those supplied with the drug even after the underused go through withdrawal biochemical changes in the body seem to force them out to continue with the crave of the drug. Treatment opioid and narcotic abuse treatment opioid overdose of the following maintain the airway to administer the oxygen initiate IV with a D5W administer naloxone NARCAI for 0.4 milligrams 1 milliliter. Monitor patient's cardiac rhythm. Treatment withdrawal opioid narcotics for those who receive the maintain patient's airway. Initiate IV D5W. Administer the barbiturates. Administer the benzodiazepine PO, carbamazepine, phentermine, and Viceral. Benzodiazepines are administered to prevent nausea and vomiting. Monitoring patient's cardiac rhythms. Alright, 4.3 General Central Nervous System. The presence of the defined example of the wide variety of the drug with different physical with the chemical properties include with the category groups together with the alcohol with the general depression, central nervous system, alcohol with the barbiturate sedatives. For example, the classification of drugs, alcohol with the drug with the becoming addictive with the one most with the central nervous system, depression with the alcohol can produce synthetic naturally fermented fruit with the grain, vegetables, alcohol usually consumed in the United States in the form of beer, liquid, or wine, alcohol abuse, alcohol acts depression with the central nervous system slows it down when the alcohol is absorbed with the bloodstream. After the absorption, bloodstream alcohol is distributed uniformly all over the body fluid with the alcohol into the brain, easily controlled with the potent placent barrier with the fetus and with the pregnant women. How fast alcohol is absorbed with the bloodstream with the body with the fluid, depending on the kind of the drink of the beer, with the sweet, with the wine, absorbed more slowly than the dry wine, distilled spirits. In the contents of the stomach, how quickly is alcohol absorbed, how rapidly affected the user with it, depending on when the stomach is empty, full with the full stomach, it slows down rate of the absorption rapidity, effects for the drink and effects for the alcohol, depending on the amount of the alcohol consumed in the circumstance, consumption, setting on the body size, and on the experience of the drinker. Intensity of the alcohol affects the person with not you with the consuming the alcohol, you with the showing sign with the drinker, assuming someone with you with the drink with the condition, drinker with learn how to adjust the behavior to change with the alcohol, begins with the behavior, the physical reaction alcohol brings with the person becoming more talkative, appear slightly few with flush, with becoming someone with uninhibited with his action, with an individual who staggered with the blurred vision shows. Have you seen with the drunkenness, alcohol consumption causes some of the people to become emotional or morose, while other people become aggressive and hostile. General effects of the alcohol. Very high dose of the alcohol can cause the person to pass out with the central nervous system slowed down enough that the person may die, but the moderate dose of the alcohol reduces the person's ability to perform tasks that require physical coordination and mental agility, such as driving the car, performing a desk job well. Driving the car while under influence of the alcohol is particularly dangerous. Long-term effects of alcohol, physical dependency. Individual can become physically dependent on alcohol after a few weeks of heavy drinking over a period of several years with a gradually increased drink with the physical dependency with it to the point which withdrawal symptoms experience with the drink if the drinking stops. Signs of symptoms of the typical withdrawal of the physical dependent person include appetite loss, nausea, anxiety, sleeplessness, severe agitation, irritability, confusing tremors, vomiting, illusion, hallucinations. Signs and symptoms caused the severe withdrawal include the delirium, tremors, the convulsion, the exhaustion, and perhaps cardiovascular collapse. Psychological dependence person who finds himself drinking in order to deal with the stress of the day of living becomes psychological, but depending on alcohol, early sign of the drinking pattern include with the drinking, relieving the boredom, and depression, drink with escape of the unpleasant emotional reactions, or situation drinking to relax just before going to the new social situation related to illnesses. Alcohol is related to the wide range of illness. Note these facts. An alcoholic has twice the chance of the premature death of a non-alcoholic person. Several forms of liver disease associated with the alcoholism, cirrhosis of the liver, the third fastest growing cause of the death among 20 to 40-year-old males years of age. Alcohol is higher than the normal rate of peptic ulcer, suicide, and pneumonia. Suicide, pneumonia, cancer of the upper digestive respiratory tract, tuberculosis, characteristics that many heavy drinkers vary, vitamin deficiency, gastritis, sexual impotency, infection, alcohol-related neurological disorders include loss of sensation, loss of memory, and mental confusion. Other non-psychiatric conditions associated with alcohol consumption: alcohol hallucination, delirium, trend with acute mental disturbances marked by pain, sweating, tremors, visual and auditory hallucinatory, very consultative disorders. Early warning signs of alcohol drinking problems usually develop over a period of time. There are almost a warning sign of an individual may be one with the alcohol. If it is difficult to get along with when he is drinking with the drinks because he is depressed, drinks until he is dead drunk at times, drinks till he calms his nerves, drink can't recall some of the drinking aptitudes, hides liquor, lies about his drinking, never eats when he's drinking, neglects his family when he's drinking. Treatment: if you come in contact with a person who is an alcohol abuser, refer him to a local drug abuse counselor. If no such person exists in your area, notify the officer in charge. Barbiturates are powerful sedatives which are introduced in 1930 with the drugs legitimately medicine used with prescribed by the doctors calm the patient with induced sleep. Their action, like alcohol, is slow down central nervous system property with the drugs, make the patient feel relaxed, drowsy, and sleepy. Incorrectly, the barbiturates can result with a psychological, physiological dependency, even death. Example of barbiturates include the barnotial, psychobarbital, pentobarbital. User of barbiturates can easily take a fatal overdose, either unintentionally, accidentally, because of excessive use that leads to the deterioration of personal problem-solving ability. Additionally, increased use of barbiturates does not lead to the increase of tolerance of barbiturates because the user is not thinking clearly because there is no way to build up the tolerance of barbiturates. He may take much or right amount too soon with tragic results. Sedatives include the category of drug with relatively anxiety and tension muscle spasm produce sedation, prevent convulsion of the drugs are on the market with a minor tranquilizer sedative with hypnotic self-inducing anticonvulsant, prevent convulsion of the drug safer than other central nervous depressants, but some can be physical, psychological dependent with long use of the sedative as a result of the experience of withdrawal systems. Examples were Valium and Librium. Signs, symptoms of the central nervous system depressant abuse, overdose. Critical with the central service of the depressant overdose include constricted pupil initially, dilated pupils of the eyes, late stage respiration, slow and shallow respirant acidosis, increased hydrogen in body fluids caused by failure of respiratory system, eliminate carbon dioxide, deficient hypotension, abnormally low blood pressure, cyanosis, bluish discoloration, skin, lips, and nail beds as a result of the insufficient oxygen of the blood, shock syndrome, coma, respiratory arrest. Withdrawal. Signs and symptoms of withdrawal may begin within 6 to 24 hours. Last of the central nervous system depressant included are the following: anxiety, weakness, abdominal cramps, nausea, or vomiting. Or orthostatic hypertension, abnormal low blood pressure occurring when the individual gets up at the time of the recombinant lie down, leaning with a reclining position, blood drops rapidly with the person standing up, consequently fainting. His common system of the type of hypotension, visual hallucinations, seeing things that aren't there, seizures, delirium, hypothermia, very high blood pressure, cardiovascular collapse. Treatment of central nervous system depressant abuse, overdose for the following procedure: the maintain patient's airway, administered oxygen, initiate 4 with normal saline solution, administered sodium bicarbonate 4 with the doctor's order, correct with a pH balanced alkaline urine in the urine. Do not give the patient stimulants. Withdrawal of the following: initiate 4 with the normal saline solution, administrate support measures as necessary, hospitalize the patient. 4 central nervous system stimulants. We'll cut the tape there.